Hey, welcome to The Explainer. What if I told you that for over 1 billion people, getting healthcare isn't a given? Today, we're diving into the huge barriers they face and a surprisingly simple solution that doesn't start in some high-tech hospital, but right in their own neighborhoods. So let's get into it. Okay, so this right here, this is the big promise. It's the foundation for everything we're talking about today. The World Health Organization's constitution says it loud and clear. Health is not a luxury. It's not a privilege. It is a fundamental human right for every single one of us. But, that's the real question, isn't it? It's a beautiful idea on paper, but when you actually look at what's happening on the ground, well, the reality for millions of people looks very, very different. And here's the stark truth. This is the core issue we're digging into. The data, the stories, they all show that people with disabilities are far more likely to have their health needs go unmet. They face this whole collection of obstacles just to get the kind of care that many of us just take for granted. So what exactly are these obstacles? Because it's not always as simple as, there not being a hospital nearby. Often, the barriers are way more complex. They're all tangled together. And sometimes, they're completely invisible if you're not the one experiencing them. So let's break this down. Of course, you've got the barriers you can see, right? A clinic with stairs but no ramp. A bill that's just impossibly high. But honestly, the biggest hurdles are often the ones you can't see. Think about it. Imagine not being able to understand what your own doctor is telling you because there's no sign language interpreter. Or worse, being treated badly just because a staff member is prejudiced or uninformed. And this quote, wow, this just makes that informational barrier painfully real. This comes from Muhammad Akram, a young man in Pakistan who became deaf. His family, his doctors, they all just talked around him, not to him. Don't worry, they'd say. But he was left completely in the dark, powerless over his own body and his own health. So let's be really clear here. This isn't just some minor hassle. This is a fundamental breakdown of a person's right to health. And, when the system itself is the problem, maybe the answer isn't to try and fix it from the top down. Maybe you have to build something totally new, from the ground up, right inside the community. And that brings us to this really powerful idea. It's a strategy called community-based rehabilitation, or CBR for short. And what it does is it basically flips the whole traditional model on its head. Instead of asking people to climb impossible mountains to get to healthcare, it brings the healthcare right to their doorstep. At its very heart, CBR is really all about a shift in power. Instead of relying on some outside expert to come in, it trains and empowers local people. It uses local resources. The whole thing is built on this idea that the community itself holds the key to helping its own members live full, included lives. And this chart shows perfectly that CBR is so much more than just handing out pills. It's the whole shebang. It covers everything from promoting healthy living and preventing other health problems, all the way to providing direct medical care, rehab therapy, and getting people the assistive devices they need to thrive. It's holistic. And that's the crucial point. That simple, beautiful idea, meeting people where they are, that's what makes it so incredibly powerful. It's flexible, it's human-centered. So, enough with the theory. Let's see how this approach is actually building bridges in the real world for real people. Because, theory is one thing, but the real proof, the real power of CBR is in the lives that it completely transforms. We're going to look at 3 amazing stories from India, Thailand, and Kenya that really show this strategy in action. First up, let's meet Harshada from India. She was born deaf and blind. For the first 10 years of her life, she lived in a dark corner of her family's home, totally isolated. She couldn't communicate, she was completely dependent. Then, a CBR worker came into her life, and the after, it's just incredible. She's playing with dolls, she's learning to communicate with her family through touch, she's taking her very first steps outside. And how did this happen? It was so simple, but so profound. A trained local worker just started visiting her at home. They didn't perform some miracle surgery, they taught her basic life skills, and they helped her family navigate the system to get the support they were entitled to. It was just consistent human-to-human connection. Now let's jump over to Thailand and see how this can work on a bigger scale. A hospital in Sinshan actually integrated CBR right into its main care system. They put together a mobile team, doctors, therapists, and started doing regular home visits. This simple change meant that families no longer had to make those long, expensive, and really difficult trips to the hospital. Life got better for everyone.
And CBR doesn't just knock down physical walls, it tackles attitudinal ones too. In Kwale, Kenya, children with albinism faced terrible stigma because of myths and misinformation. They were often hidden away. So the local CBR program went to work. They educated leaders with the actual facts. They taught parents simple, practical ways to protect their children's skin. They even did this genius thing where they partnered with local hotels to get sunscreen donations. They broke down prejudice with knowledge and practical help.
These stories, they show us something so incredibly powerful. They bring us right back to that initial promise of health for all, and they suggest that it's not some distant pie-in-the-sky idea. It's something we can actually build, one community at a time.
When we think about solving these huge health gaps, our minds tend to go straight to shiny, complex technology or massive budgets. But what these stories show us is that the real solution is often something much, much simpler.
It's human connection. That's it. It's the worker teaching a little girl touch language. It's the mobile team showing up at the front door. It's a whole community deciding to choose understanding over stigma. That is the real technology here. And all of that connection, all of that progress is powered by just one thing: the will to actually do something. The simple, powerful decision to see a gap and decide we're going to build a bridge right here, right now. And that's really the key takeaway from all of this. Community-based rehabilitation proves that health for all isn't just a dream. It is an absolutely achievable goal, and it's built on a foundation of local action and simple empathy. So the model is there. The results speak for themselves, which really just leaves us with one final question. If this kind of community action can bridge some of the world's biggest and most difficult health gaps, what are we all waiting for?